Imagine this. You're a perfectly healthy 54-year-old Canadian woman actively training for a half marathon. Life is good, your health is solid. Until one day, you come across someone online who convinces you that you have a so-called allergy. They insist you need their program to fix it. What happens to your kidneys next will shock everyone. Catherine here, I'm a doctor of natural medicine, and today it's time for everyone's favorite, a mystery from the emergency room. This is a case so perplexing that it left a whole medical team scrambling for answers. Now, this case was published on the Canadian Medical Association Journal, and it's a very interesting case for us because it teaches us one crucial lesson. The wrong dietary choices can lead to devastating consequences. This patient went from training for a half marathon to needing a wheelchair and nearly ended up on dialysis, all because of one simple dietary mistake. A mistake that many people might knowingly be making right now. This patient, we will call her JS, endured a long and stressful series of tests that brought her on the brink of dialysis. And it was only through a stroke of luck that her doctors eventually asked the right question and ordered one simple blood test that finally solved the mystery. But let's start from the beginning. JS is a 54-year-old woman who arrived at the hospital with a chief complaint. She couldn't walk. She also reported severe fatigue and a heart rate of 103 beats per minute. Not alarmingly high, but notable. JS thought her elevated heart rate was simply due to anxiety from being in the hospital, and this tells us something important about her. She avoided doctors at all costs. It took significant pressure from her family to convince her to seek medical attention at all. But by then, her condition had deteriorated so much that it was clear something was seriously wrong. And now the big question is, will they be able to find what's wrong with JS before it's too late? Well, let's take a look at the symptoms first. On examination, she had swelling and a rash on her legs. Her calves were particularly tender when touched. She experienced excruciating pain that seemed out of proportion to the visible swelling. And these are the first clues to what was happening to her. But the first thing doctors were concerned with was not a diagnosis at this point, but ruling out a blood clot. Remember that they didn't know this was a dietary issue because nobody's first guess here will be the diet. And a blood clot, if untreated, can travel up into the lungs, and that could be fatal. In fact, forgetting to rule out a blood clot when symptoms are present is something we call a never event. A never event is a serious, largely preventable incident that should never occur in a healthcare setting. So doctors are trained to make sure this kind of stuff never happens. This is why the first thing they did with JS was ordering an X-rays to see if the problem was coming from her bones. A rapidly progressing infection or a fracture, even a tumor, could be causing the symptoms. But that was not the case. So they went on to do an MRI as well, which luckily was done without contrast. But all that they were able to see was edema or fluid in her legs, as we can see. And guys, I know what you may be thinking here. If there is fluid in her legs, they need to check her kidneys as well, because kidney disease goes often unnoticed, and while it doesn't cause you to be, unable to walk, it can cause swelling. But you see, doctors weren't worried about her kidneys at this point. No. Their main goal was to rule out a possible cancer. This is why what they did next was a CT scan of her chest, abdomen, and pelvis to search for signs of cancer. And do you know what kind of CT scans they do to search for cancer? Yeah, a CT scan with contrast. So let's talk about CT scans with contrast and why they are dangerous. Imaging tests are used to get a clearer picture of what's happening inside your body. These tests are almost always used to detect some dangerous stuff going on. In this case, they are looking for cancer. But it's important to understand that even if a doctor really needs to use dye in a test, they should be very careful if the patient suffers from CKD. A CT scan with contrast like what JS was receiving right now can seriously put your kidneys in danger. There are reported cases of patients in stage 3 being pushed in stage 5 by the contrast dye used in a single CT scan. So yeah, imagine doing a scan to find out what's wrong with you just to upgrade your kidney condition from concern to catastrophic. This is something called contrast-induced acute kidney injury. Now, as I was saying, when JS presented to the hospital, her kidneys were fine. Her creatinine was just mildly elevated, not high enough for her doctors to be concerned about her kidneys. However, there is just a certain amount of contrast dye the human body can tolerate. And all her medical team achieved until now was to rule out cancer. So, is this woman risking her kidneys for nothing? And most importantly, will her medical team be able to diagnose her in time? Now guys, it's clear at this point that JS doctors were stumped. They kept doing tests without finding anything for a while, including a EMG. This is a test that measures the electrical activity produced by the muscles in her legs that also came back normal. And the only thing that was clear at that point was that they were looking in the wrong direction. They needed to take a step back and start over with their differential diagnosis. Which is like saying that you can only bang your head against a wall so many times before you think, maybe I should try the door. So they scratched all these exams they did and went back to the basics, to JS's blood work. Because you see, there is a new clue we need to take into account here. JS was suffering from anemia. And it's not just that. You see, when JS came to the hospital, she already had anemia. Her hemoglobin was 9.6 grams per DL, which is already low enough to be something to worry about, and it may even explain her fatigue. But now, after 3 days in the hospital, her hemoglobin was 7.3, and that's severe anemia, which can cause not just fatigue, but complications as well. At this point, her heart and kidneys were in danger. Now, when anemia is present, the very first thing we do is looking into the size of the blood cells. This is extremely important for CKD patients as well. In fact, when red blood cells are too small, it may indicate an iron deficiency. When red blood cells are too big, a B12 deficiency may be present. However, her red blood cells were normal in size. Another test confirmed that her body was also making enough red blood cells. And that prompted, wait for it, another battery of tests. Now guys, unfortunately at this point, the doctors were still looking in the wrong direction, her legs, because of course that was where the symptoms were. Actually, what they were trying to find out at this point was where all those blood cells were going. So other blood tests were ordered, urinalysis were done as well, and a skin punch biopsy was performed. And all that while the patient was getting worse and worse. Now guys, let's take a step back and while JS doctors keep looking at her legs, let's see if we can understand what's happening here. Given the symptoms she has and all the clues were collected during this investigation, can you tell what kind of issue was she having? Now guys, I know that these symptoms are not really going to tell anyone what the cause of all the JS's problems is. I mean, if her doctor didn't solve the case at this point, I don't think anyone else will. Of course, let me know if you already have an answer. And there is one more clue I will give you. In fact, as you can probably tell from the title of this video, we also know that this woman was following a diet with a crucial danger. Now, her diet is important. It is the clue that actually got her doctor to make the right diagnosis. We also know that JS was following a diet that was supposed to help with her perceived allergies. So, we also add that to the list. Now guys, let's play a quiz. Let's see if you can make a diagnosis before her medical team. Given those clues and the fact that JS has a perceived allergy, can you tell what kind of diet was this person following? A pescatarian diet? Or maybe a keto diet? Or was JS a vegan? Maybe a carnivore? Or was she doing intermittent fasting maybe? If you think you know what's happening at any point, write it down in the comment section. Because I believe the answer will surprise you. But probably not as much as it surprised her doctors. I mean, imagine doing all kind of medical tests for days and finding nothing just to discover that the issue was not a disease that patient was having inside her body. But instead, the disease was caused by something the patient decided not to put on her table anymore. So can you guess which one of these diets can cause the symptoms we are looking at? Pescatarian, keto, vegan, carnivore, or intermittent fasting? Which one is the answer? After 7 days in the hospital and a bazillion of medical exams, JS was exhausted. I mean, even more exhausted. What's worse, her medical team has been sleepless for days at that point, and they were wandering the hospital like zombies, asking anyone if they knew who could cause an otherwise healthy woman to not be able to walk anymore. And it was by pure chance that one day, some of the doctors from her medical team entered JS' room at lunchtime. It was probably just in order to tell her to go see a shaman or maybe look into a cure for a demoniac possession. But before they could start introducing the possibility of an exorcism, they noticed that JS consumed almost no food at all that day. Everything was still on the tray. "What's wrong, JS?" asked one of the doctors. "Are you having a little bit of nausea today?" But that was not it. So the doctor finally asked the right question. "JS, is there something about your diet we must know?" "Oh, why yes," told them JS. "I'm not eating fruit and vegetables anymore. Don't you know they can cause you allergies? I'm a carnivore now." And guys, let me tell you what, you would have done the exact same thing if you spent 1 week doing test after test while the patient was basically disappearing from anemia just to find out your patient decided to stop eating fruit and vegetables. At that point, the doctors ordered the only test that actually mattered, a vitamin C test. Her vitamin C level was so low, the test wasn't even able to determine it. Yeah, that's what you risk by following bad advice on the internet. Vitamin C deficiency or scurvy, just like a pirate. "Arr, zero vitamin C, congrats, skipping the fruit, are we? All that's missing is the eye patch and a parrot screaming, 'Eat an orange, ya landlubber.'" Anyway, now the big question is, has JS diagnosis arrived in time, or has she suffered from anemia long enough to do permanent damage to her heart and kidneys? Because I mean, scurvy might be old-fashioned, but it still packs a punch. Well, we will find out in a moment. Before that, there is a lesson to learn from her story. Question, do you have enough vitamin C in your diet? Guys, I know what you may be thinking right now. We are not pirates, Catherine, and most of all, none of us is following a carnivore diet. Why should be worried about vitamin C deficiency? Well, truth is, you're probably not going to end up hospitalized for a vitamin C deficiency, alright? But that doesn't mean you should be walking around like vitamin C is optional. Nope. You should absolutely look into getting enough of it every day. And good news, it's not rocket science. A woman like JS could hit her daily recommended intake for vitamin C with just one medium-sized orange, half a cup of red bell pepper, a single cup of strawberries, or even, wait for it, one kiwi. That's it, one kiwi. Yeah, remember, one kiwi a day keeps the scurvy away. However, it's also worth pointing out that people with kidney disease are more at risk for vitamin C deficiency than the general population. In fact, you may need to follow a diet that limits your potassium intake. And many of the foods that are rich in vitamin C are also rich in potassium, but not all hope is lost. There are also foods that are low in potassium while being rich in vitamin C. Some examples include strawberries and other berries such as blueberries and raspberries. These are amazing for a renal diet. And also apples, watermelon, grapes, pineapple, and more. Always make sure you have some of these foods in your diet because basically, as long as you're eating some fruit and vegetables and not just subsisting on raw milk and bad internet advice, you'll be fine. Now, during my research for this video, I found out something fascinating. Most countries fortify their foods with vitamin C. In the US, for example, breakfast cereals, fruit juices, and even some dairy products get a vitamin C boost. Yeah, it's like health insurance against scurvy, except it doesn't deny you coverage because of some pre-existing condition. And yes, scurvy may not be common anymore, and that's in part due to the fact that most countries fortify foods with vitamin C. However, there is one notable exception, Canada. That's right, the land of hockey, maple syrup, and polite apologies does not fortify foods with vitamin C. Recently, more cases of scurvy have been popping up there. So do yourself a favor and don't take any risks. Just eat a kiwi. Your kidneys and your inner pirate will thank you. Okay, now the big question. Was JS able to make a recovery? So was JS able to eventually go home safely, or did the scurvy and the anemia this disease causes impacted her body in a permanent way? Let's take a look. As soon as the medical team suspected scurvy, JS was immediately started on oral vitamin C. The results were dramatic. Within 24 hours, she felt more energetic. By 48 hours, her bruises began to fade. Over the next few months, her body repaired the damage, resolving her anemia, joint pain, leg pain, and rash. JS was eventually able to make a full recovery. Now guys, if you want to watch more mysteries from the emergency room like this one, my video up here is for you, and this is all for today. Thank you for watching. God bless you all. Bye-bye.